Ladies and gentlemen,
This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate of the University of North Carolina Chapel Hill School of Dentistry. He has lectured nationally and internationally on topics such as practice management, marketing, and advanced dental communications. Currently practicing from Charlotte, North Carolina, please welcome Dr. Chris Bowman, DDS. How's it going, Dr. Bowman?
Hey, great. How are you doing?
Doing well, thanks. Appreciate you taking your time being with us here on the show. Now, just to get our listeners a little bit acquainted with you, can you tell us what was it that drew you toward dentistry, and at what point in time you thought to yourself that you wanted to become a dentist?
Yeah, that's a great question because originally I wanted to be a sportscaster. I figured it was like the perfect profession for me because I wanted to be on TV. I get to go to all the games for free, and all I have to do is tell people what's happening. So I thought that was just perfect. I was 16 years old, and I played a lot of competitive racquetball at the time. And this is back in the early 80s, so I'm aging myself. But I was in a doubles racquetball match. It was actually a semifinal match in the tournament. And I got hit in the mouth with a racket. And it absolutely shattered tooth number 9, my upper left central incisor. So we called our dentist on a Friday night at 9 p.m. and showed up at his office. And he was nice enough to meet me there. And throughout the process of getting my tooth fixed, which for me was a root canal, post and core, and a crown back then, I just really started to get interested in dentistry, started asking him questions about, what it's like to be a dentist. And I've always had good experiences at the dentist. I never had any bad experiences or any issues that would cause me to not like dentistry.
Mm-hmm.
And an interesting side note, at that time, my dentist had also just gotten a brand new Porsche 944. And back then that was a really sweet sports car. So here I am, 16 years old, just get my tooth fixed, and my dentist got a new Porsche. So of course I want to be a dentist. So little did I know that the profession would actually be pretty well suited for me. I ended up becoming a psychology major in college, undergrad, which was absolutely perfect for what we need in the dental practice and dealing with patients on a daily basis and dealing with all the emotions and the behaviors that patients exhibit in the practice. And I've also focused quite a bit in my career on communications, mainly to solve the problems that were happening in my own practice. So, all of those things contributed to dentistry really being a great fit for me. Also, the entrepreneurial aspect of dentistry and knowing that I could own my own business. I can pretty much live where I want to live, and I can largely control my practice by making my own decisions. So I'm a pretty independent guy too, and all those things seem to fit really well with me. So I'm actually quite fortunate that my tooth got broken.
Yeah, that's a great outlook to have when that took place.
Yeah.
No doubt. Certainly a good outcome. Now, you mentioned. Oh, sorry. Go ahead.
No, I was going to say it's really funny because recently, about a year ago, I actually lost that tooth. So now here I am. I'm 51 years old, and when I was 50, because of some external resorption, which was a result of the past trauma, I lost tooth number 9. So now I'm in the process of getting an implant placed and implant restored and all that kind of stuff, and that'll speak to the concept that no one wants dentistry, that we can talk about a little bit later.
Okay. Now, you had mentioned about starting school and majoring in psychology. Can you tell us a little bit more about where you went to school and that path?
Yeah, sure. I went to the University of North Carolina, Chapel Hill, and I'm from Asheville, North Carolina. So always a Carolina fan and wanted to go to school there. And again, fortunate that they have a very good dental school there. And I originally thought, well, gosh, I've got to be a science major to be a dentist because it's a health profession. And again, I realized that, number one, I wasn't really interested in the science curriculum for either chemistry or biology, for example, but I was really intrigued by the psychology courses that I was taking, and becoming a psych major ended up just being the perfect thing for me. So, when you couple that with the pre-dental courses, I only had 4 electives all the way through my 4 years of college, but the psychology background actually prepared me as well, if not better than anything else, in my opinion, for dentistry.
And now, when you went out and started off into the dental field, did you immediately go and purchase your own practice, or did you come in as an associate at a different office?
Yeah, I originally became an associate at a large dental office that's north of Charlotte, North Carolina. I had chosen Charlotte as a place I wanted to live because it's a growing city, a lot going on and a lot of potential for future growth. Um, I didn't want to immediately practice in Charlotte, though, as an associate because of non-competes and things like that. So
Mm-hmm.
I worked for a very large dental practice, a very successful dental practice in a town outside of Charlotte, which left me the opportunity later to come into Charlotte and open up my own practice, which was my ultimate goal. I really do appreciate having worked for another dentist for a couple of years because it gave me an opportunity to essentially have a private practice GPR, so to speak. So I got to do a lot of dentistry, didn't have to worry about the ownership issues, and I wasn't ready for ownership at that time. That's an individual decision for each person, depending on their business acumen and things like that. So it was good preparation. After about 6 months, I did realize that I wanted to have my own practice. So I stayed there and I kept an upfront communication with the owner doctor of that practice. And then, when the time was right, I found the opportunity to open up a practice in Charlotte and I did it.
Excellent. Yeah. Now, when you opened up your own practice, how would you describe its layout, and how did you help it to grow throughout the years?
Yeah, good question. So a couple things happened. I found a space and the space had the capacity for 5 chairs. And I'm still in that space today. So 23 years later, I'm in the same space. I started out with 2 chairs and quickly got a third. I got a third chair like within 3 months. One thing that helped me a lot was there was an older dentist who was retiring, and he was about a half a mile from my practice.
Hmm.
He was literally 80 years old. So he was retiring. And he literally had some dental instruments from the University of Virginia Dental School that were dated 1940
Well,
that were in his instruments. So very interesting. So basically what I was doing was purchasing his patient files, paid a very low, fee for that. And so it got me started with about 200 core patients, which was great.
yeah,
So,
that's nice.
started in 1996. My first month, I did 30,000 in production, which back then was not bad for a startup to do 30,000 in a month in 1996 out of nowhere. And it gave me a good little core from which to build my practice. Of course, I started marketing right away, and so I started to grow it organically and through external marketing.
Now, in the marketing idea, how have you worked to increase your reviews and positive feedback from your patients?
Yeah, well, the first way you do that is you give them a great experience. So if you
Yeah.
give them something worth talking about, they're going to talk about it more often. Interestingly enough, a lot of the things that patients tend to remember and tell other people about are the non-clinical things that happen in your practice. In other words, how well you treat them, the
Hmm.
things that you do for them to make them comfortable, the relational things that you do for them and that you talk to them about. Those are the things that really enhance their experience and make your practice kind of buzzworthy. One thing that I do is I ask new patients when I come into the operatory for the first time. When I meet them for the first time, I say, "How was your experience here?"
Hmm.
And the feedback I get from that is fantastic. Almost always they'll say it was great, it was awesome, it was a great experience, and I want them to articulate that because it drives home the point. We use an automated software that automatically sends them a request for a review. So that's allowed us to skyrocket our reviews in the last 2 years. So we're able to get more reviews in the last 2 years than we did in the previous 21 years through using the software.
Now, a quick question for you on that. Have you ever utilized Groupon to help your practice?
Yeah, interestingly enough, I have. And first of all, I'll tell you what I chose not to do, and then I'll tell you what I did. So
Yeah.
um, originally, when Groupon first came out, about I don't know, 10 years or so ago, I always like to experiment and test different marketing strategies. So I said, let's try this. So I tried a whitening offer, and it worked, but it didn't. In other words, I got a lot of patients from it, but we were able to convert very few
Hmm.
because all they wanted was whitening. And no matter, we have great service in our practice. We we do a lot of different things that a lot of practices don't do, but the patients that came in just wanted that one service. Groupon contacted me and asked me to do another offer because we got such a good response. And I said, you know what? I'm only going to do an offer that involves multiple visits to my office. So I had been wanting to launch what many of you would call an in-house membership plan or in-house membership program. So I created a program called a private care savings program for people who don't have insurance. So the program costs $365. So for $1 a day, you could have excellent dental care for a full year and save 15% off your dental care. So on Groupon, we were offering it at $179 initially. And, Groupon at first was like, oh, we can't do that because that's a lot higher price. And I said, well, let's try it. I'm in Charlotte. It's a good market. Let's test it. And I had to speak with their national sales manager to approve it. So we started doing that in 2011. And even today, I still have a Groupon offer for the same private care savings program with a few variations, but we still get new patients off of that today. Now, the difference between that and a typical Groupon offer is that our price point is about 3 times higher. Right now, it sells for about $150. They've lowered the price a little bit over the years. But when people buy this, they realize that it involves 2 hygiene visits, x-rays, exams, and 15% off their dentistry. So what happens is we get more repeat business off of it instead of a single visit Groupon deal. A single visit Groupon deal often encourages people to do a single visit with an office. And our deal encouraged them to repeat in our office. And then once we gave them a great experience, the rate of renewal for the next year, stayed really high. So that's been a really successful thing for us.
Now, in that process, I mean, we've all had that kind of cookie cutter experience. It sounds like it's a totally, a nice, fresh viewpoint to be going from. How do you help to encourage your patients to agree to a treatment?
Well, the best way to do that is to hold off on presenting treatment. And what I mean by that is, I think that if you look at the way most dentists and dental school students are trained, they're trained to learn how to diagnose a condition or a problem. And then they're trained to determine the best solution for that. And then they're trained to learn how to do that. And the problem is when we get into private practice, we talk to our patients the same way. We say, hey, John, you got a cracked tooth with an old silver filling in it, so you need a crown. And then this is how the crown's going to go for you. And then a lot of times they go through the process of explaining how a crown is done, which is like the last thing you want to talk about. I've always said that if dentists were travel agents, no one would go on vacation, because we would always talk about like the process of going to the airport, standing in line, waiting for a delayed flight, and so on. We would never talk about what it's like to be at the destination. So what we need to do instead, and this is the thing that I teach in my communications course, is we need to understand how to recognize and present and describe the dental problems and conditions that our patients have in a very compelling way, so that they understand what's going on inside their mouths. And once they understand the problems and conditions that they have, once they thoroughly understand that, and that they're not going in the direction that they want their oral health to go, then they're going to be much more receptive to learning about the solutions to those problems. So, I've always said that no one wants dentistry. I alluded to that earlier. No one wants dental care. No one wants dental work. But what they do want is they want the problems that they know that they have to go away.
Yeah.
So when you can get really good at presenting problems and conditions to your patients, then your acceptance of treatment is going to go way up. And the way to do that is to spend a whole lot more time talking about the problems that you see, showing them good digital photographs of those problems, and then describing how those problems progress if they're not treated, so that patients begin to say, hey, what can you do about this? How can you fix this? Instead of spending all this time talking about the treatment that is for a problem that the patient may not realize that they have, because oftentimes we jump too quickly to the solution. So I call that leaving them behind at the problem. This is one of the major components of my communications course is showing team members and doctors how to recognize and and describe problems and conditions in a compelling way.
Excellent. Now you mentioned the digital photography in there. It makes me kind of curious about as we move forward towards the digital era of dentistry. What are your thoughts about the digital impression scanners and CAD/CAM technologies?
If you commit yourself to the technology will be great for you.
Mm-hmm.
We've got 2 scanners in our practice, and we use them daily. It is really, really nice as a dentist to, number one, not have to worry about taking impressions for patients. It's really nice for patients to not have to worry about having their mouth full of goop, as they would call it.
Yeah.
And, we don't, very few, if anybody, gags when they're doing a scan. A lot of patients, I haven't really found any patients that fear getting a scan,
Mm-hmm.
but a lot of patients fear the impression. And when we tell patients, hey, we have a scanner now, so we can start your orthodontic case, or we can start your, veneer case without having to take those big goopy impressions, they're like, oh yeah, wow. So I would say scanners are huge. CBCT technology has been great in our practice. So if you're going to implement it, if you're going to use it, it can be very successful. Now, there's some other expensive technology in a practice that may not prove to be as profitable. It all depends on whether or not you're going to commit yourself to it or not.
Now, in kind of going along those same lines, do you have any other cutting edge type of equipment that you've recently introduced to your practice?
The CBCT and the scanner are the 2 major things
Mm-hmm.
that we've implemented in the last 2 years that have been great for us. Another great thing is the T-scan. Now, T-scan's been around for quite a while, I think maybe 12 years or so, but that's the occlusion analysis software using what I call a bite sensor.
Mm-hmm.
That gives us time and force information on someone's bite. So, every dentist has struggled with those patients where you just can't get them comfortable after doing some dentistry. And the T-scan really allows us to really know what those blue dots mean. You could use articulating paper all you want, but I would defy anyone to tell me which dot hits first and which dot hits with the most force.
Yeah.
And that's where the T-scan comes in handy. So if I were to point to anything that could be a big problem solver for us, it would be something like that.
So, doctor, aside from running a successful dental practice as well as being a speaker, we also see that you have a website called Dental Insiders. Can you tell us more about that?
So, the impetus for Dental Insiders came about through me trying to solve my own problems in my practice. And those problems related to what we were just talking about. Like, how do I get patients to actually agree to doing the dentistry that I know is in their best interest, but for some reason early in my career, they weren't accepting it at the rate that I felt they should be accepting it. Like, why are they not doing this? Because it really makes a lot of sense for patients to do the dental work that you recommend, but for some reason they're not doing it.
Mm-hmm.
And I started, going backwards and thinking, gosh, what are we not doing, or what are we doing wrong? Where are we missing the boat in our communication with our patients? Because I really felt like it was a lack of proper communication. And as I went back and unraveled our processes and rebuilt them, I realized there were several different areas where we were missing the boat. One of them is something I just talked about. We were jumping to the treatment recommendation way too soon, and patients still were left behind thinking to themselves, well, nothing hurts. I don't feel like I have a problem. So if you can't convince me that I have a problem, then I'm certainly not going to do any dental work.
Yeah.
Patients perceive dental work to be something that's very inconvenient, very expensive, very time consuming, and possibly even uncomfortable. So why would they go through all that trouble if they don't recognize that they have a problem? So that's the missing link. So solving all those issues in my practice led me to sharing a lot of those answers. Like, when I discovered something that worked in my practice, I've always been part of message boards and email groups and now Facebook groups. And
Mm-hmm.
when I share things that I've learned, people would respond and go, wow, tell me more about that. And then eventually some other doctors said, well, you should teach a course on this. And I said, okay, well, who wants to do it? And that's kind of where it all came from. So I began coaching dental practices. And so I do private coaching. I, like I said, my communications course can attract dentists from different parts of the country. So that's how it all came about.
Now, when it comes to the intraoral procedures, do you have one that is really your favorite?
Well, since the beginning of my practice, I've really enjoyed cosmetic dentistry. Um, I love the emotional appeal of being able to help someone who is really uncomfortable with his or her smile.
Uh-huh.
Just all of a sudden, they just love it. That transformation is great. Someone who's ashamed about their teeth, not just the appearance, but maybe ashamed about their level of health. And when you can really turn that around, either through veneers or through orthodontics or through restorative dentistry, um, for me, that is probably one of the coolest things that we can do. Um, I was one of the first dentists to be trained in the pinhole procedure for gum recession, which is a fantastic procedure. It's an alternative to gum grafting. And, that's another procedure that doesn't just have cosmetic benefits, but it also has, some oral health benefits as well. And being able to help patients with that has been a really cool thing. So all of those procedures have been great for my practice, and they've been great for my patients.
And now, as the year is starting to wind down, do you have any upcoming courses or events that you're going to be hosting?
I'm not actually. The rest of my year is pretty quiet.
Mm-hmm.
However, I do have plans to hold my communications course, and we're finalizing the dates right now. So, for example, late February, I'm going to be in Florida.
Okay.
And I'm also planning on being in the North Carolina area. We're deciding right now between Charlotte and Raleigh, maybe even Atlanta in March or maybe April. I am an instructor for 6 Month Smiles, which is a cosmetic orthodontics company. So I'm going to be teaching that course in Las Vegas in February, Boston in April, Dallas in May, a lot of different locations in 2020. So we've got a lot going on. My website, Dental Insiders, when it relaunches, is going to have dates and locations for my Get More Yeses communications course. And it'll also list, where I'm going to be and when.
Obviously, you're going around, you're doing a lot of teaching. Do you also attend conventions and gatherings?
I do.
Mm-hmm.
I love to attend different conferences. In the past, I've attended the American Academy of Cosmetic Dentistry, which I love. Smile Source is a great group of dentists. It's a independent group of independent dentists, and so they have a great meeting called the Exchange each year. I do have a goal to go to the Chicago Midwinter meeting in February. And I've got some other things that I'm considering for 2020. So just a whole mixture of things. I love what I've found is that in most cases, for me to get the specific information or material that I'm looking for, a lot of times I need to travel.
Mm-hmm.
I am fortunate, though, that in Charlotte, there are more courses and more CE events coming to this area. There's some great CE to be had just in the Charlotte area. So a lot of options for next year.
Would you have any advice for new dentists coming into the dental field?
Oh, gosh. We could probably do 5 podcasts on that. I would say that some of the things that I've mentioned already are really critical. Number one, focus on communications, focus on ethical sales strategies. Now, when I say sales, I don't mean trying to talk someone into doing something that they don't want to do. What I mean is showing them how the stuff that you do as a dentist, the services that you provide, are a really good fit for the wants and needs of your patients.
Mm-hmm.
And the only way to do that is to help them discover their own wants and needs. So, and then also to be able to show them the things that you can do for them. So, I've got a couple of sayings that I have in my practice, and one of them is give your patients the opportunity to say yes or no to your best care. So you got to give them the opportunity to say yes or no to your best care. The only way that you can do that is if you show them what's going on inside their mouths, if you also show them what you can do for them, and if you can connect those two things. And if you can do that, and that's all through communications, and it's all through excellent photography. There's no better way to communicate dental conditions and issues than through dental photography. And so those are some things that I would point to. Focus on business courses and learning about business, learn about entrepreneurship and marketing. Notice all those things I just said are non-dental. So, you know, it's not just about being a better clinical dentist. There are a lot of really good chefs, for example, that have struggling restaurants. And there are a lot of really successful restaurants who have, good chefs, but not necessarily the best chefs. So it really doesn't boil down to the clinical skill of the chef, so to speak. It boils down to the ability of each person to run their business properly. And there are a lot of components involved in doing that.
Wonderful. Now you mentioned about the photography, and that, kind of like that old saying is, a picture's worth 1,000 words or so. How do you utilize this even further? Are you showing patients like before and afters or similar situations to their diagnosis?
Yeah. So one of the coolest things that we do is everybody's heard of before and afters, which are a great way to communicate cosmetic dentistry to patients. There's another sequence that I use called the before, during, and after, which is fantastic for restorative dentistry. So, first of all, with every new patient, we take a series of anywhere from 12 to 16 photographs of every new patient. And that involves full face photographs, full smile photographs, with the cheeks retracted and the cheeks unretracted, with the patient biting down, the patient slightly open from different angles, a full occlusal upper, full occlusal lower, and then individual quadrant photographs. And we can do this in about 5 minutes if it's done properly. So it can be done very quickly if it's done systematically. Using those photographs to show patients the way their teeth are right now is the best way to communicate their current conditions. I would say that even when you do that, they still often don't really understand what's going on inside their teeth.
Mm-hmm.
So let's suppose you got some old silver fillings, for example, or some old white ones. Let's suppose there's some gray shadows around some of those fillings. Now, most of us would agree that that usually represents decay or a cavity under the filling. And most patients just don't really understand that or get that. So a really good way to communicate that problem to a patient is to show them pictures of someone else's teeth who you've already treated. And what we do is I show them the before, the during, and the after.
Mm-hmm.
So I show them a picture of the patient's teeth before we start, and then I show them a picture of the teeth after I've removed the restorative material, but before I've removed all of the recurrent decay, for example.
Yeah.
And what it does is it reveals the problem under the teeth or under the fillings. When they see that, there's like a visceral response. It's, oh, God, that's gross.
Jaw dropping, which is right where you want them.
Exactly. That's usually what gets them to understand, hey, my teeth look like that guy's teeth. So what's going on under my fillings is probably what's going on under that guy's fillings.
Mm-hmm.
So when can you fix my teeth? And then I show them the after to show them what we can do. But a lot of dentists rely on the after picture of their restorative dentistry, but the patient's still sitting there thinking, I don't know if I have a problem because I don't feel anything. So, patients need to understand that dental pain and dental problems do not correlate. They don't go in sequence with each other. So in other words, when you have a small cavity, you don't have a little bit of pain. But if you ask patients, that's what they think.
Sounds like you got the ability to do quite a few different procedures in your office there. Is there any procedures that you actually outsource, or do you keep everything in-house?
No, there's some stuff I hate doing. So I haven't done a root canal in a long time. And I don't like doing them. I don't enjoy them. I would acknowledge that for younger dentists, I would encourage you to learn how to do root canals because it's very profitable and you can keep it in-house. If you can keep it in-house, you can really increase the value of the procedure that you provide for a patient. So if you can do a root canal, post and core crown, or root canal build up crown in one appointment, that's awesome. I just don't enjoy the procedure. So I'll outsource that. And another interesting thing, for years, I outsourced extractions. And again, back in the 90s, it was a little bit different than today. There was a major focus on cosmetic dentistry and building the cosmetic practice. I would not say that my practice is a purely cosmetic practice, but part of that meant for me, I want to associate my practice with saving teeth, rebuilding teeth, and making teeth more beautiful.
Mm-hmm.
And at that time, extractions didn't fit into that equation. So I actually referred out a lot of extractions, and I still do today. What I've learned, though, is that when you extract fewer teeth, you end up doing fewer implants. So I'm beginning to do more implants in my practice now. And part of that equation means involving yourself in doing more extractions, because that of course leads to bone grafting and immediate implants and even implants that you do later. So for younger dentists, I would say, get comfortable extracting teeth very atraumatically so that you can increase the number of implant opportunities that you have for yourself. So I wouldn't suggest to necessarily follow my path there.
Gotcha. No, that's wonderful. Thank you. If our listeners want to contact you, can you give us some information?
The best way to reach me by far is to email me at my email address, which is chris@dentalinsiders.com. Chris@dentalinsiders.com, CHRIS, and insiders is plural, just to be clear. The website, dentalinsiders.com, will be launching within the next 30 days or so. Definitely by the end of this year, it'll be launching. And like I said, there'll be opportunities to, consider my communications course, which is for the dentist and the entire dental team. And again, there'll be information on where I'm going to be located. And for those dentists who are interested in me coming to their practice, I also do that as well. Just a couple of weeks ago, I was up in Michigan at a private practice coaching them for 2 days. Earlier this year, I was in Cincinnati. So, I can do that as long as my schedule allows. So those are the best ways to reach me.
Excellent. We'll make sure and have all your information listed underneath the podcast here, and hyperlinks for the listeners to get in touch with you easily. Thanks again for being on the show. Really appreciate it.
All right. Thanks very much for having me.
You got it. Take care. Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.